on.
Yeah, now it's good. Okay, so side lying technique. Can you come and lie on your front, facing up? On your back, facing up. Good, okay. So just as a recap, again, I'm not setting the client yet. Good. I'm just showing you how to prepare the client from, say, supine position, facing up or facing down, yeah? Because you will never start a treatment, a sideline treatment, when the client is on their side. Not likely, okay? So what you're gonna tell them, you're going to ask them to turn on their side. So what you're gonna do is to say, in a second I'll ask you to turn that way, yes? Can you do that now? And give them a chance, and you create like a sleeve inside to turn them, yeah? Good. So this is how you start. Now you need few more things to do. Can I have the second? Yeah. Few other things you need to do to realize first that the problem with side lying technique is that the body is really wobbly. Yes. They can get seasick. So any idea how to stabilize them? It can be pillow in front, and you need to move their leg to bend them. When you bend their legs, that gives a lot more stability. Yeah. Then you can do one of the following. You can put the pillow in between their leg. Yeah. And after that, you could then put another towel. Yeah. You can do the tea towel as usual. Yes. You can do that this way, and then put the towel that way, if you remember. So all their body kind of covered nicely, yeah? Mm-hmm. Then you ask them to raise this arm, like that, and then if you can tuck the towel underneath your body, with your hand. Yes, can you tuck it underneath? Yes. So you ask them to do that, yeah? Mm-hmm. Tuck the towel underneath, so then they are ready, yeah? So you can as well put another pillow here, so they can hold. So you see there are quite a lot of preparation. Yeah? At times, if the room is quite hot, then you don't need the lower towel, but today is a wintry day in London, so really you do need a lot of towels. Okay. Now we need to talk about the pillow. And what I would like you to come, even the camera, come around here. And I would like to show you quite a big misconception people have about pillowing. What they do is that they put the shoulder on top of the pillow. So what happened, can you make it even exaggerate it? Yeah? They're not having the neck supported, they raise their whole body. So what you need to do is to do that, and then be sure that the pillow really support well the towel, the head and the neck. So you can see that it's really get into the groove of the neck. That's what you need it. And sometimes you need to even fold it. So if you see that the pillow is here flat, raise your head. I'm really putting it more in, and then you can relax. So the head should be really relaxed. And at times what I do, even apply a little bit of pressure. What the pressure does, it sends a signal to the muscles to relax further. Yeah? Okay. Now, there are a few ways that the pillow can be. It can be straight with the table. Yeah? But what happened is that you see the axis between their, this is the axis of the head. So the tendency of the head to fall forward. It's not good enough. What you need to do is to identify it and to change the pillow this way. So they cannot, the head is not going to fall forward. Yeah? There are few other things about pillowing. Some people need two pillows. Some people need no pillow or flat pillow. Yeah? So you really need to play to just being able to show that the neck continues with the spine. Not too low or not too high. Yeah, so sometimes too many pillows is not good. You need to do the right one, okay? So let's come around back to there, back to the other side.
Camera?
Yeah, continue. Okay. Now, another difficulty. The table is quite wide. If the client is going to be there, and I want to do some mobilization, I'm going to have a backache. So sometimes you need to ask the client to shuffle a little bit towards me. Okay, closer. Yeah, good. Okay. So that's enough. So the hip is close to me, and now I can mobilize the body or the body parts easier. I will start working with mobilization, and then we work on other technique. One of the problem I have that this client I didn't know has a sport bra, so I can't really massage fully, but I think that because situation like that will arise, I ask to keep it in that and to see how we can manage it as we go, okay? When mobilizing any body part, you need to make that muscles around relax as much as possible. And the only way to do that is if you support it well. If you start mobilizing that shoulder like that, for that client is okay, but a lot of other clients, hold it here, they will hold the muscles because they don't feel a good support. Yeah, relax. So that by itself is not really helpful for their body because their mind doesn't feel good supported. So you need to support them well. To support well, you need to really have few contacts with them. So you can have one contact here with your body, and so you see here 4 contacts. One with this hand, 2 here with my ribs here, and forearm to forearm. So the way to do that, quite simple, is underneath to shoulder, fix in both places. Okay, I'll let you practice soon. Then you are not moving your arms. The leading is your posture. Back to, remember what we did with weekend 1, yeah? Movement coming from your body. And now you try to do that as large as possible. So I'm going backward, downward, forward, and upward. Now the tendency in something like that is to create a lot of tension in our body because it's quite difficult. The position is quite difficult, yeah? So try to have your hands not digging into the trapezius muscle. You know, start maybe slow. And then grow slowly bigger. So this is 1. So again, I'm not losing the contact with my body. If you are a female therapist, and that's really how physiotherapists doing it, they're fixing it. If you need to fix it into your chest area, yeah, then you use either a pillow or a pillow would be good, and then you're free to do more.
Are you going always
All
that same
direction,
way?
and no, there is no, you can do the other way. Okay. Alternatives to that, you can do it by, that would be probably a lot easier. I'm fixing their hand with my hand, and again moving my body. The other side.
So when you're doing that, you're always bringing her quite back.
You're trying really 360 degrees. Okay? So these are 2 options. Okay? Then you can put the arm there. Then there is the more obvious mobilization with the arms up. Okay. Now, when it comes to the arms up, you have to consider that some of your clients can take their arms only up here, not all the way. So just stretching it too backward might be quite difficult. Yeah? So the axis of the arms up does not mean pure 180 degrees. Yeah? So we have to be careful. You're coming around here, and you're bringing the arms up, and again you're stabilizing it in 3 points. 1, 2, and 3. So you actually on their hand. Now, depends on your change in size between you and the client. You might need to be further out, or you might need to be further close. So, because you need to be able, as you would see, to mobilize the scapula. So what I'm doing here, I can do it only that way. This is a stretch, isn't it? Mm-hmm. Good. So this is a stretch. I stretch all the lateral muscles here. I stretch biceps and triceps. Okay, practice that. The second one I would like you to do is to think about mobilizing in this position the scapula. This is mobilizing the shoulder joint. Mobilizing the scapula is actually holding the scapula here, in here, and then you're moving it as you go. Good. So it gives freedom to all the muscles that are around the scapula. Teres minor and teres major. Yeah. Rhomboids, trapezius, latissimus dorsi. Yeah. So I use that as a joint help to stretch, but also to mobilize.
Were you pulling up as you were going around on the
up? Yes, I can pull up. What I'm doing, if the scapula is a triangle, I'm taking the lower part and try to pull it up, and then try to pull it down, backward, forward. Yeah? All direction. Now, how do I know if I exceed the amount? There is what's called end point. If you start feeling that that's it, it doesn't go any further, don't pursue it. Okay? So far we did only 3 mobilization. I think it's important to do it well. So how about getting into pairs and start practicing, okay? Just on turning, stabilizing them, getting them close, get your body right, and then start to move your body with it, and so you can do the 3, yeah? Later, when we see that that is fine, we'll add more soft tissue into it. So we'll add, say, compression, or looking for a position of ease, and then work with it, okay? Yeah, let's start, shall we?